Thank you very much, you brave warriors who are still here with us today after such a long day. There has to be a certain brilliance, I think, to be called to just do something differently. And I think that there has to be a certain level of bravery to be willing and able to step out of the box, not only in your thinking, but in practice. And there's so much inertia and gravity to not doing that. And that's pretty much what we're going to talk about today. I'm here to talk to you. We talked a lot today about what functional medicine is, but assuming that at some point you drink the Kool-Aid and you want in and you want to know how you can do more of this, or you want to know what this looks like, we're going to talk today in the next 45 minutes or so about what it looks like in practice right now, what you can expect when you get there, how am I going to do this? How do I integrate this in? Is it easy? Is it hard? What are the tricks? So I got way too much information for you. I've got way too much. I got way too many slides, and nothing kills a good talk like a good PowerPoint slide. So we're going to I want you to just kind of like take it in, but let's stay in the conversation. I'm just going to try to give you a high level experience of what I've had the honor and privilege of experiencing so far. I'm going to take you, we'll start with who I am and why you should give a darn at all what I have to say, because that's the first thing you should always be asking yourself. Who is this person and why should I listen to what they have to say? And then I'm going to just kind of take you through my experience and what I have, the models that I've gone through, what I've learned from them. I'm going to show you a little bit about what functional medicine might look like that's a little different in a day-to-day basis from a typical conventional practitioner, because I've now had the experience on both sides. And then we're going to take a look at the models of functional medicine, how you can do things differently. And then what I'm really excited about to talk to you, time permitting, is what we're doing now and what I think, what I hope, what I'm investing myself into the future of not only functional medicine, but medicine in general, because I like to think that they're not going to be exclusive. So this is me. My name's Jeff. I am the Executive Medical Director of the Inspire Health Center. I was recruited by Adventist Health to help them get back to their values and their traditions of whole person care, which fits really well with a functional medicine model. I was astonished, I was floored, I was so excited when they showed me what their vision of what they wanted to do was. Now, this wasn't me trying to convince them to do it. It wasn't the functional medicine community trying to convince big medicine what to do. It was big medicine coming to me and saying, we get it, we want to do it, not really sure how to do that. How can we figure this out together? I have, I think, a somewhat unique experience in that I'm conventionally trained. I'm an MD. I did a conventional family medicine residency training. I spent almost 20 years now in medicine. I can't believe it. More if you consider the preschooling that goes into that. I graduated from medical school in 2000. Boy, do I feel old right now. 20 years from graduation. But strikingly, not a lot from my perspective has changed in the conventional medicine realm. And it's been 20 years since medical school, so I can't speak intelligently about what medical school looks like, but I think I get it. And it's only been 5 years since I was faculty at USC in the Department of Family Medicine at the residency program, teaching residents how to be doctors. And I know that we weren't talking about any of this stuff, which is why I'm no longer there. I started to make some changes in my own life that I did not learn from my medicine experience. And in doing that, I started to walk through doors and start to get some knowledge and start to meet some people that I couldn't go back through the doors anymore. So I made a big leap and I joined a functional medicine practice, which we'll talk about later. That led to the experience of having the opportunity to be in some other models. I want to take a pause and talk to you, if there's only a couple of things that I really want to leave you with today. And one of those things is, regardless of whether you're a student, a practitioner, a pre-medical student, whatever it might be, I can remember when I was a faculty in residency and people would ask me why I went into family medicine. And I said, I think that when you're a family medicine doctor and you're trained with that kind of breadth to really do anything, I think that you can do anything. And so many people were concerned about going into family medicine. Well, I'm not going to be able to pay off my loans, and I'm going to have to see 30 patients a day. And my answer to them was, only if you decide that you're going to do that. And if you train yourself well, you can do things differently. And I don't think people really believe that, but we have to. We have to have a greater vision. Nobody that ever changed the world did so by just doing things the way that everyone else is doing it. And I don't know about you, but I wouldn't mind changing the world. And whether that looks like the sisters, the good doctors that shared that experience of changing a little boy's life, which to me is, I mean, you could just be done. You know, you did it. You lived a good life. Or is it on the other end of the spectrum where you're trying to invade the belly of the beast, big medicine, and infuse this stuff into a healthcare system? But you got to have vision, and you also have to have belief. You have to believe that it can be done. Otherwise, it's going to suck the life out of you. And that's really what was happening to me before I found this path. So I think we've kind of beaten this horse to death. We understand, I think, the conventional medicine model versus the functional medicine model, and I agree with some of my colleagues here today. We're not here to bash conventional medicine. I'm a conventional medicine doctor trained. I just have a new way of looking at things. I think that Western medicine and pharmacology is a tremendous blessing. I just don't necessarily think it should be our knee-jerk reaction to problems that have solutions of better living and consequences and side effects. This, if you look from above, signs and symptoms, that's kind of the conventional model. You can see all the little silos, hepatology, urology, neurology. That's kind of what our conventional medicine system looks like. All the branches of the tree. Organ system diagnosis. But then if you look below that, this is where the functional medicine paradigm comes in. This is how it's different. So you've got fundamental organizing systems and core clinical imbalances. That's the difference. It's how we think differently about what's going on. And so instead of attacking symptoms, we attack sort of ways of living, life choices. How can we do things differently that will have different effects? And then this is where I get really excited. Look down here into the roots of what's going on. Yes, there's genetic predisposition. Of course, we talked about how that's more like 20% of it. More is like 80% of it. Mental, emotional, spiritual, purpose, experiences, attitudes, and beliefs. Your thoughts create your experience. They create your health. What you choose to do, what you choose not to do, right? But here's what's really cool. Thoughts are super important, but what's more important than that? Down here. Sleep, exercise, nutrition, these are actions. Actions are more powerful than thoughts, right? You can't necessarily think yourself into action, to better action a lot. Otherwise, we would all be going to the gym, we'd all be eating healthy. It's not easy to think yourself into better action. It's a lot more effective to act yourself into better thinking. We'll talk more about health coaching and other technologies that are really important in transforming lives. Real quickly, this is sort of the transition of what we're doing. We talked all day about urgent and chronic care. Conventional medicine does wonderful things in taking care of people that are really sick and sick right now. What we're doing is transitioning to living well, and through that, we'll have better performance in life. And performance might be your work. Performance might be being a father. It might just be feeling and functioning well. Here's an idea of, this will give you an idea of what just a day in the life of a patient or a doctor might be in the different realms. When I was purely a conventional medicine doctor, or the experience that I see a lot of my patients still having, is they'll say, well, the doctor did my labs this year. And here's what that typically looks like. You're not meant to see this, but you get a sense of the paucity of lab testing that's done. It's a complete blood count. It's a complete metabolic panel, complete, and fasting lipids, right? Doctor did my labs, everything looks good. Well, here's what I usually do. So all that stuff and more. Inflammatory markers, nutritional markers, maybe heavy metals and toxins, at least the big ones, mercury, hormones, other metabolism markers. There's a nuance there that we'll have to talk about in a second, but when we're just doing these things over here, we're not screening for health, we're looking for disease. And just because your labs are normal doesn't mean they're healthy, right? Normal is defined as what 90% of the population has. It's the top 5 or 10%, the bottom 5% that are out of normal that raise a red flag, but that doesn't mean that they're healthy, right? So we're looking to help people get into the sweet spot. We're looking to kind of catch disease early so that we can turn it around. I'm not going to wait for somebody to have a hemoglobin A1C of 7 to start treating them for their diabetes or above, because our goal is 7. 5.7 is the upper limit of normal. So if you're 5.4, and the next year you're 5.6, and the next year you're 5.7, let's talk about the trend, the direction that you're moving in, and what we can do to slow that down. How does it look differently in terms of how I talk about and approach my patients from a treatment perspective? Well, this is the conventional model. Anybody in medicine is very familiar with the assessment and plan. You have a symptom or a diagnosis, and for that symptom or diagnosis, you have a treatment, which we've already talked about today, usually looks like a medication, a referral, or a procedure. My plans typically look like, what are we going to do as far as your nutrition? That might require some supplements, depending on what your nutrition requires and how we need to fill those needs. Movement, sleep, stress reduction, and then medications. Not no medications necessarily, but let's take care of the underlying problems. If you're a person that would typically get a medication because of a problem, and I give you that medication, I will help you prevent that disease. I will help you prevent the outcomes, but I don't take away the underlying problem that requires the medicine. You're going to need to keep taking that medicine, and the fire is still festering underneath. Does that make sense? So James shared this earlier. I'm just going to kind of blow through it. This is where the evidence is starting to build, and the important thing here is not so much that we see improvement, we see that improvement sustained for at least a year, and that we know that these things work. It's that this was the Cleveland Clinic. So it's not comparing me to your average family practice or your average internist. It's comparing it to the standard of care, what we would expect to be the highest level, and it's still doing better. Let's talk for a few minutes about the tools that a provider has in their toolbox. We're going to talk about how it looks differently. Continue that conversation a little bit in a daily practice. These are tools that the Institute of Functional Medicine provides. I love the Institute of Functional Medicine. They provide a wealth of handouts and tools that make practice much easier, make the absorption of this information much easier, make the teaching of patients and patient education much easier. And it's developed so much over the past 5 years since I started to become a student there. The tools that are now available to me make starting in this journey so much more easy, and they support you so much. These are functional medicine lab tests. You've heard a little bit about some of these things sprinkled throughout our conversations today. These are tests that are not traditionally taught in medical schools or even residencies. I had never, a complete diagnostic stool analysis, heavy metal and environmental toxin testing, these things were not being done in residency training when I was teaching residents 5 years ago, and I don't think that they are now, because most of the providers that I see showing up for the Institute of Functional Medicine are seeing these things for the first time and having to master them. But they provide a wealth of information. Let me give you an example. So a very, very common issue is irritable bowel syndrome, right? You guys probably see a couple cases of irritable bowel syndrome, right? Gut issues plague our population. And if you don't fit into a specific category, if you're not celiac disease or have inflammatory bowel disease, if you don't fit into a very specific diagnosable condition, you may get thrown into this pot of, well, you have irritable bowel syndrome, and we don't really know what's going on there. There's a couple of medicines that can reduce your symptoms. But guess what? There is more advanced testing. you can do a comprehensive diagnostic stool analysis that will show you all the imbalances that you have with your gut. And so then you can do a targeted treatment that helps to rectify those imbalances. And guess what? We see people get better all the time. We see people get better from irritable bowel syndrome, which previously was they got no relief from. And then other tools in your toolbox is just the support of the community. I mean, even a conference like this, we have so many providers that when I moved here from Southern California just 6 months ago, I was welcomed into the community of functional providers, and I'm so excited to be working with them now. But these conferences, the people, they're so excited to be doing what they do. They're revived in their energy of practicing medicine again. There's a lot of support. The Institute of Functional Medicine, James and the Evolution of Medicine and Functional Forums, even the nutraceutical and specialty lab vendors, a wealth of information. They're doing a lot of research. Granted, you always have to be considering their biases. They have some skin in the game, but you can look at their science and evaluate it for yourself, but they provide a lot of support. And of course, there's no shortage of podcasts these days. Let's talk for a little bit about business models, because hopefully when we figure it all out for you, when you graduate from medical school, you'll just come out and get a functional medicine job. But right now, that's not the case, right? So let's talk about what it looks like right now. What are some models of success? And then we'll talk about future state too. So if you've studied medicine at all, you know that there are a couple of categories. There's fee-for-service models. So this is typically outside the insurance realms, or even the insurance realm is based on fee-for-service. You go to see a doctor, you go to see a provider, they render a service, you get paid X for that service. So insurance doesn't do a great job of covering the type of care that we ideally want to do with our patients, because ideally it comes down to spending more time with them. It comes down to hearing their story, digesting it, and processing it with them. It also comes down to throwing some spaghetti at the wall and seeing what works. Not so much because I don't know what will work if we do it, but because I don't know you yet to know what you're capable and willing to do. And so we have to spend some more time together, right? So a lot of doctors in functional medicine sort of, as James was talking about, his first book was about, this is how you do it outside of the system. Right? This is what you're going to have to. You're going to start a practice. Everything's going to be great. You're just going to do all these things on your own. One of the problems, though, is nobody teaches you how to do business in medical school. So we'll get to that in a little bit. But so there's a fee-for-service model, and that's sort of where the concierge practices come from, and the direct primary care models. There's subscription models that have emerged that have been very, very successful. Well, instead of just doing an exchange for one visit, let's sign somebody up for a program. A, it's good for business because I know they're going to come back, but B, and perhaps more importantly, it sets people up for success because you're not going to be successful by just getting a consult and trying to go out and do it on your own. There's insurance-based models. I've come full circle. I left the insurance-based model because I didn't know or think that it could be done in that, and I'm coming back. I've been invited back to try to figure out how to do it in that model and do it well. And then we're going to talk about some innovative models. So I have had the privilege, the honor, the amazing experience of living through examples of each of these. My first job was lifespan medicine. This is what made me take the big leap out of academics and into functional medicine. It's a fee-for-service, split down the middle, and concierge as well. Successful enough, and my mentor, Dr. Chris Renna, that built this practice and has been doing this for years and years, and I learned so much from him, is able to charge, at the time, $10,000 to $15,000 per member for a year for comprehensive, holistic, functional, integrative care. But you better believe that when you're paying that kind of money, that if you have a sniffle on a Saturday, that doctor's probably driving out to Malibu to see you for your sniffles, right? That's a lot of money. And so you kind of have to, there's pros and cons to that kind of care as well, right? Or that kind of model. They also have fee-for-service, though, where you can pay $400 to go see a provider for an hour. And There's all kinds of models, $100 an hour, $200 an hour, but it's mostly out of pocket, right? Because insurance doesn't really compensate us well for time. From this position, I got the opportunity to work with Robin Berzin and her startup, which is an incredible success. I became the medical director of Parsley Health Los Angeles, and we built that from scratch, from zero. We had over 1,000 patients when I left 2 years later to come to this project, and they're growing like gangbusters now. I mean, they really just kind of hit critical mass and are expanding. This is a subscription model. Let's talk about what this looks like. You get a yearly membership. You get 5 visits with a doctor, 5 visits with a health coach, unlimited messaging, telehealth, so you don't have to go into the office. You don't have to drive in LA traffic for 2 hours. You can just be in your pajamas on the couch and talk with your doctor and go over your labs. Member discounts to health and wellness services, $150 a month. It's about $1,800 a year. So it still might be a lot for people that are already crunched and are paying for insurance, but it's a heck of a lot more accessible than some of the alternatives. And it makes it a doable model. It makes it a receivable model. And there's obviously interest. They've picked up quite a bit of venture capital and are really growing and doing very well. So you might ask, why in the world would you leave? My wife asks me that all the time. But she doesn't ask me it since we moved here, and because she sees how filled up I am with the work that I'm doing now. And so the question really hasn't rolled off our lips since we left Los Angeles. This is the Inspire Health Center. So this is the work that I'm excited to be doing now. How can we create, in an insurance-based model, with a population that is typical for the average family practice, how can we really create a model that then this organization can field out to its entire healthcare system? Adventist Health is an integrated healthcare system, spans 4 states, California, Oregon, Washington, and Hawaii. I'm pretty excited about the Hawaii part. It has 20 to 30 hospitals, 300 plus clinics, primary care and multi-specialty care. Its reach is pretty big. It's a $4 billion a year company. So we're working within this. They came to me and they said, look, we recognize what we want to do. We want to create whole person care again. We need somebody, we need to build a team. We need to create a model that is fiscally sustainable for a big system. So this is kind of the 30,000-foot view, but the vision coming into it is we want to use a functional medicine paradigm. That was their idea, not mine. 10 years of research, that's what they landed on. We also want to make that medicine approach personalized. It's not about just throwing functional medicine protocols at people. It's about individual care. How do we learn what your specific needs are? How do you take care of 1,200 people to 1,800 people? The average size of a family medicine practice is maybe 1,600, 1,700 people, which is ridiculous. That's seeing 30 patients a day, 15-minute visits. Doesn't work, right? Or you saw the healthcare data on the United States and our outcomes. That's about the best that system's doing. So how am I going to do 1,200 to 1,800 people, same size, but provide them with a functional medicine model, which requires me spending more time with them, more investment? So those are the challenges that we have. In order to do that, we're going to have to leverage technology, and that's what we're going to talk about a little bit more. And I came into this knowing that we need to do it in an interdisciplinary team-based care approach. Shout out to my partner over here, Erin Skinner. She's a registered dietitian. Yeah, let's give it up for Erin. And for all the sometimes unsung heroes, the dietitians, the nutritionists, the health coaches that really are the heart and soul of these programs and the heart and soul of making changes in people's lives. We have, current state, our team looks like this. Myself, nurse practitioner, and a nurse, all either trained or being trained in functional medicine. Our nurse right now is at a functional medicine conference. Medical assistant, we have Aaron, who does the heavy lifting. We have a massage therapist. We have a clinical a clinical pharmacist on our team. So we recruited this person, making sure that she was willing to study nutraceuticals and to approach them in the same way and with the same diligence as she learned pharmaceuticals. And then we have the Vitalize Cafe. I hope that I have time, oh boy, to get into the model that we're working on, but when I'm working with people and we tell them how we think that they would thrive if they ate in a different way, and they say, gosh, that's a lot of work. I'm gonna have to shop differently, I'm gonna have to prepare food differently, I'm gonna have to live differently. And I say, go right down the hall, so at least lunch, you can get a plant-based organic meal. Future state. So in the spot of the massage therapist, can we add a chiropractor? Can we add an acupuncturist? I'm gonna hire in this next quarter a physical therapist. We have a motion lab and a movement studio. Can the physical therapist, just like every patient I have goes to Aaron for nutritional counseling, can I send every person to PT for an exercise prescription plan? We're gonna need to integrate a behavioral health specialist. That's absolutely imperative. And then community partnerships. We work with a big gym in the area, and it's a beautiful gym. The resources are amazing. It's a great experience. Costs $140 a month. That might be tough for the average bear. But what Adventist Health does is if you go 8 times a month, we'll subsidize half that membership for you. But still, that's hard. Still, people say, I got a really hard life. I got kids. I work a lot. How am I going to get to the gym 8 times a month? And we try to work with them about that, but we also say, you know what? We're going to bring them here. What if we started doing exercise in this facility and offering classes there? Community partnerships are so important. I want to just kind of highlight some of the challenges, or what I like to see as the opportunities that we have available to us. So access. How do I get patients? And how do patients find us? And then how do we get over those barriers? Maybe it's cost, maybe it's time, et cetera. Time is the big one. The average clinical appointment for a primary care provider is probably every 15 to 20 minutes. Studies have shown that the average face-to-face time with a clinician is 7 minutes. 7 minutes. How am I supposed to help you solve your problems in 7 minutes when I'm worried about the next 25 patients I have to see for 7 minutes that day? You know what 7 minutes is good for? Diagnosis, prescription, good luck. Inertia. So many people feel trapped. So many people that physicians have a high burnout rate. So many people feel as though they don't want to do this anymore. They can't do this anymore. But you know what? I can't leave. Victim mentality, we got to get over it. We got to start putting pressure on our systems to do better. We have to overcome the inertia. Reimbursement's the big one. So most people have to see a lot of patients because it's an insurance-based model. They pay X amount per visit, so in order to make more money, in order for the organization to be profitable, we have to see more patients. As patient visits go up, time with the patient goes down, quality of care goes down. Business and entrepreneurship, I already mentioned, they don't teach you that in medical school. I hope they do now. They certainly didn't when I did. I learned business and entrepreneurship at Parsley Health. I learned more from working with entrepreneurs than I ever learned in the healthcare system. And that's wonderful. We're going to talk about some examples of how some disruptors are causing pressure, and I think enabling systems like Adventist Health to say, okay, we're going to try this. And then this is the exciting area that I get really excited about too. Not only being able to provide people with a better kind of healthcare delivery, but better healthcare delivered, but also research and development. Because what we consider value-based care, it's not really value, right? So let me give you an example. I'm probably gonna get in trouble for this. So I won't use any particular organizations, but most organizations, when they judge doctors by quality indicators, they look at things like colon cancer screening, cervical cancer screening, breast cancer screening, immunization rates. And let's throw in, like, do you have a hemoglobin A1C that's controlled? Diabetes. High blood pressure, is that controlled? Those ones make a lot of sense. The other ones make sense too. Let's keep people cancer-free, but just because you screen them for cancer and you screen all your patients for cancer, being cancer-free doesn't mean that you're necessarily healthy, and that's how we judge whether or not a doctor's doing a good job. We're leaving out a lot more than we're putting in. So what I'm excited about is being in a space that allows me to experiment, to try more labs, to try different approaches, and to be able to demonstrate better return on investment than what we're currently doing now, redefining value-based care. This is the first book that I read when I got the job. I was going into the program and I said, you know, I really want to do this right from the beginning. So, kitchen sink, how do you transform healthcare? This is written by Ezekiel Emanuel. He was involved, he's involved in healthcare policy and has a pretty extensive resume, was involved, depending on how you feel about it, with advising Obamacare and a number of other things. I think he wrote this great book that talks about all the things that you have to do to really transform healthcare. And he says, nobody does all these things. Some people excel at others. There's a couple of points that I want to point out. Number one, where's lifestyle changes? Not only in the third tier, which is the lowest, by the way, not the highest, but it's dead last. This isn't by data. This isn't by, oh, we've found that these are the least and most important things. This is through a conventional mindset, right? I would put that number one and do all the other things around it. But community intervention, shared decision-making, all these kind of things that chronic care management, these are the things that we're trying to design into our program. These are the things that you have to think about, even if you're going to start a practice on your own. How are you going to design these things in so that you can be successful, not only in terms of a business model, but most importantly in creating results? So there's a bunch of innovative practices out there, and I think that you may be familiar with some of these. Do these ring a bell with anybody here? Okay. So there's some innovative practice out there. They're kind of innovated in their feel and their appeal. Maybe their access. They have open access scheduling on the internet. Maybe their doctors are younger and hipper and they talk cooler, right? That's good. That works. You have to connect. And so I'm excited about these disruptors because they are changing the game a little bit. They're influencing it. They're putting pressure on. What I would like to see is next generation. The problem is that there's still, at the end of the day, a conventional medicine approach. So I'd like to see a lot of innovation around infusing the functional medicine paradigm. Cleveland Clinic, they're doing it. They're doing it at one of the most prestigious places, not only in the country, but in the world, and it's working. Technology. So I'm going to talk a little bit about none of these individual technologies are necessarily important, but as examples of how you have to start leveraging technology if you want to get the job done. So the EMRs that we use at this big institution are not geared for this kind of work. They're geared for diagnosis and orders and billing. There are companies that are emerging that are building these kind of systems that are more functional based. And we're experimenting with some of them, for example, the Living Matrix, to see how they might integrate into this. No financial disclosures to make. But one of the things that I like about the Living Matrix, why it's successful in the functional medicine realm, is it gives you a timeline. Can you guys see that? Is it blurry? It's blurry up here. It gives you a timeline and it gives you a matrix. So it presents to the person their information so you can tell them the story, so that you can give them a sense of why these things are happening, and so that you can clump their symptoms into a system so that you can start to deal with those things with lifestyle factors. And instead of one symptom or two symptoms melting away with a medicine, you have whole clusters of symptoms melting away because of lifestyle changes. But the reason that I like this particular product or products like it is that it allows me to use a tool that the patient puts all of their information into the cloud that is generated into a system for me so that I can go over this with them and still have a phenomenal experience with them, an experience that they haven't had before with their doctors. But I don't have to spend an hour and a half taking the history myself. I still have time to connect with them, but the connection is telling them the story, helping them know that I understand this better and what we're gonna do to leverage their problems, right? And that's really working very well. I can't tell you how many patients since I've been involved in this new model sit with me when we're going over this information, sometimes on our first visit, and they just say, nobody's ever explained this to me. I've never seen anything like this before. And we get thanked all the time for it. Another quick example, just had a patient the other day, came in and I told him what we do, said, would you be interested in a more functional or comprehensive evaluation? He said, well, I see a functional medicine doctor up the road. Oh, it's great. It sounds like you're probably really well taken care of. But he's like, well, I'm gonna get my labs done anyway. I'll come back and see insurance is covering it here at the office. Okay, great. Came back. He's been on thyroid medication for a long time. I, doing all of my labs, saw that he had anti-thyroid peroxidase antibodies. He has antibodies to his thyroid. That's autoimmune disease. That's the reason he has underactive thyroid. And I said, well, I guess you knew this. You've been on thyroid medicine forever. What's that? Well, let me get this straight. You just got put on a medicine years ago by a functional medicine doctor. You never heard the word autoimmune disease. You didn't know that this is treatable. You didn't know that this is potentially reversible. You didn't know that this is potentially stoppable. There's a lot of other things that we have to do in our practice that a traditional EMR doesn't let us do, electronic medical record, like prescribe nutraceuticals in some cases, right? Food's the best, but sometimes you need to help people out. Sometimes you need to use adaptogens or botanicals that are known to have effects on reversing disease. And so systems like this actually allow us to do that with ease, rather than saying, hey, go get some ashwagandha. That's really proven to help balance your HPA axis. We can actually help facilitate that they get a good product delivered to their door at a reasonable cost. Telehealth and telemedicine is a technology that we need to integrate more in our practice. We don't have any Adventist health providers in Roseville. And so anybody that goes to a different provider, it's leakage of the system. It's lost money that we could fuel back into taking care of our patients. But we have Adventist health experts in 4 states. I have a telehealth machine in my office. We can start having consults with those providers, me present or just the patients. And Parsley Health has figured this out. And now you can see they've gone from 3 cities to bam. They're all over the place now. I put this in here because I think if you're anything like me, you think of technologies as sort of the doodads, the computers, the iPhones, the physical technology. But technology is actually the application of scientific knowledge for practical purposes. And I want to talk to you about some of the most powerful technologies that I think exist. Health coaching. So I think that you got a doctor, a patient, and a health coach in the room. I think the patient is the most important person in the room. The doctor's last. The health coach is the next important person in the room, because the doctor's job is to kind of help do the cognitive work, not make decisions for the person, not tell them what to do, but to figure out what they want to do and what they're willing to do. Infuse that with a little science to help them make their choice. Good, thank you. I hope that's going to work for you. I wish I had more time to do it. And most physicians don't have the skill to help people make behavioral transformational change, but health coaches are trained to do that, and it's a gigantic industry right now. It's booming. And we're producing tons of health coaches, and we need them because behavioral change is hard. If it was easy, disease wouldn't be rampant. It wouldn't be getting worse rather than better. Another technology that we have to use, going back to the question, how am I going to take care of 1,200 people, 1,800 people in a functional medicine model? I can't see 30 patients a day. It's not going to help them. Certainly not going to help me. I'm not going to last long at that. So if I use group visits, we've seen this slide before, right? Instead of boom, 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 instead of 8 patients, let me tell you what leaky gut syndrome is. Let me tell you what leaky gut syndrome is. Let me tell you what leaky gut syndrome is. You know how many times I've described what leaky gut syndrome is? Too many, right? But then again, not enough. But if I can put all those people into one room and do it once, that's efficiency, that's business sense, that's sustainable. And what we're going to do is we're going to take these courses and we're going to We're going to put them in series. Or maybe if you have gut health issues, you come in here, but in there you learn, hey, I'm also overweight. Oh, you have a program for that too, right? And so if I carve out an hour a day or 2 hours a day to see 10 to 15 patients, and I see patients one-on-one still, it's not this or that, it's both, but I double my productivity in terms of the way that bean counters, administrative and executives of healthcare organizations are looking at it. And I can bill legally, legitimately, relevantly, every single one of those people in the same way as if I was seeing them one-on-one. Now, you might say, hey, that's great for a business, but why would I want to see the doctor in a group when I can corner that guy myself in my own visit? Well, because A, you can do that, but you're going to get 7 minutes, right? 15 maybe, 20 if the doctor's great and they love spending time with you. But you're probably not going to get a lot of the answers. How about we have a group visit and we at least talk about all the common things? I answer all the basic questions that I answer over and over and over and over. We go through your labs, not yours specifically, but I explain how many times have you had a doctor explain in depth what all of your labs mean? Probably not a lot, right? Because I can tell you every time I do it to people, they're like, I don't know what just happened. Nobody's ever done that before. But we have these technologies will help us be more sustainable. You can do this in a private practice. My new colleagues here in Sacramento, the people that you talked to earlier today, they have been integrating these things, and very successfully, I might add. We already talked about this guy, Mark Hyman. He's the carrot that the Cleveland Clinic has been dangling at the end of the string. People come in, they want to see Mark Hyman, all 2,000 of them. They have to go through a 10-week program. Guess what? 80% of them, don't quote me on the number, but it's high. 68, I think it's closer to like 80%. They don't need them anymore. They got the support, the education, and the accountability through the program. They're better. So now I get to talk to you about corporate wellness, right? Here's why I want to talk to you about it. Permit me to read a quote. Well-being is becoming a core responsibility of good corporate citizenship and a critical performance strategy to drive employee engagement, organizational energy, and productivity. It is also a growing expectation among the talent companies want to most recruit, access, and retain. No longer an option or narrowly focused element of the rewards menu, well-being is now front and center as a business imperative for leading high-performance companies. So, Adventist Health has created a human performance model. Our goal is to create life-work integration. The wording here is very important. It's not life-work balance, because that still implies a dichotomy, that still implies balancing. If there's more work, there's less life. If there's less, no, it's work-life integration. So how do you learn to incorporate all these things? How do we as an organization, and with all the people that we employ and work with, move them from this chronic care management or urgent care management to living well and performance? And I'm going to do super high level here because we don't have the time to go through all of this. But this is what my experience looks like. We take care of urgent care every day. People are sick, they want to see a doctor. They have a problem, they want to see a doctor. They have plantar fasciitis, they want to see a doctor. But when they come in, we Trojan horse family medicine into them. None of my visits are less than 30 minutes. If you have a sore throat, you have a 30-minute visit, because guess what we're going to talk about when you're in there about your sore throat? Hey, how's everything else going? Do you feel like you're a pretty healthy person? How do you know that? Has anyone checked under the hood? Oh, they did their CBC and their complete metabolic panel? Maybe we could do a little bit more. Are you getting the attention that you really deserve? And they're all coming back. They're all coming into that 75-minute intake visit, and they're astonished. The cafe, we're going to be starting a teaching kitchen. And then overall Human Performance Life Work Center, that's the coaching. Human performance coaches. Don't just coach about healthcare, or health care issues or health coaching. They also teach about communication, relationships, how to be better at home, not only at work. I'd love to go into depth. This is a different talk. It's all the different levels of moving from personal improvement to organizational improvement, and then community improvement. This is obviously very clear to you. This is a very simple slide. We break this down into, again, personal and professional well-being. There's drivers of personal well-being. This is where health coaching and human performance coaching comes in. There are drivers of professional well-being. There are energy anchors, purpose, mind, renewal, fuel, relationship, personal energy. Guess what these things map to? The modifiable life factors, nutrition, how you eat, how you sleep, how you de-stress, of the Institute of Functional Medicine's matrix and the functional medicine paradigm. Again, life-work integration. Human performance coaches are there to engage. I tell people all the time, we're going to be successful if we have you follow up with a nutritionist, a registered dietitian, or a health coach that's going to provide you not only with education, but also support and accountability. Coaching will not be another thing we do. It will be how we do what we do. This is from the human performance executive that recruited me to this job and designed this program over a decade. Our associates will be excited to engage with a human performance coach. It will be something they want to do with the internal motivation to improve their personal and professional well-being. We as leaders have to start with self-empowerment so that we can then empower others and then empower high-performing organizations. We're talking about the healthcare system. Maybe we're talking about our office if it's a private practice. And maybe we're talking about the patient, making sure that they understand that the core of this is self-empowerment. They have to take responsibility for their health, but it's hard. How are we going to help them do that? Then they can empower others. Maybe they take their message home to their families, maybe their distant families, maybe the people at work. And then we get high-performing organizations. We get high-performing communities. This is another vision of what we're going to be doing moving forward. My shout out to Joe Morrell, my administrative director, my partner in crime. Couldn't do it without these great teammates that I have. But this is his vision, actually. When you come into a business, when you come into a new job, you get a Foundations of Health program. This is part of your orientation for work, right? I don't care if you work at McDonald's, probably going to be harder to find this there. Sorry, McDonald's. Or UPS, or whatever it might be, you go through this program. And it looks like this kind of education over a series of weeks. But then there's longitudinal training. The existing employees go through this program too, and then they keep going through educational programs. I don't think that the answers to healthcare, the solutions for healthcare, are in healthcare. I think that the solutions for healthcare are in education. And they're in building systems that are healthier. We talked about all the environmental toxins. Holy cow. All of the food that's produced and processed and refined that's making us sick, the way we are living is making us sick. And we have to basically not only build the healthcare system back up from the ground, but we're going to have to kind of do that in our communities as well. There's a lot of questions to be answered. Give me a couple years, I'll figure it all out. We'll solve all these problems for you. I might need a little help, so I'm looking forward to working with the rest of this community and all of these leaders. Thank you very much for letting me be here, and I'm looking forward to the panel.